child with no father, for that man with no place to stay, for that little boy living with AIDS. Here's my shoulder, lean on me.
Welcome to Hope Network Clinic. Please come this way and look at our humble beginnings on the wall here. Pictures of how the clinic began. It's the construction process, where everything started. The clinic is for the uninsured. It's a safety network for people to come to have a healthcare home. We see patients from all around the metropolitan area. We have a medical clinic, and we also have what we call a Show Me Healthy Women clinic for women ages 35 to 65. This is the waiting room where the patients check in. They hang out here and wait until the doctor or the nurse practitioner sees them. If we'll come on around here, I'll show you the front lines. This is Evelyn. Evelyn and I, we maintain the front desk here. We check the patients in, and then while they're in the waiting room, sometimes they'll pick up a literature or brochure about some of the other parts of the clinic. Sometimes they'll pick up a free Bible. We just are part of the front lines to get them ready to go back and have them get comfortable so they'll be ready to go and see the doctor.
Hi, my name is Alicia Quinn, and I came and saw Dr. Harder because of my lazy eye, and I got glasses, but then the lenses were too thick, and then one eye was bigger than my other one, and at school kids started making fun of me, and I got really sad, so I started talking to Mr. Harder about it, and I wanted contacts, so he said that was okay, and I got used to it. My eyes started getting much better, and kids don't make fun of me anymore.
Hi, my name is Alicia Gibson, and this is my son Cameron. We had originally made an appointment for Cameron because he was squinting a lot in front of the TV, and I didn't know if he was just doing it because he couldn't see or if he was being ornery. He is in an early learning center, so he's really needing some extra help, and I've seen the improvement since he's got his glasses. And you're goofy, aren't you? And we had found out about the Hope Network through Dr. Erger, who had actually told my mom about the charity who provides glasses to kids like Cameron who otherwise may not be able to afford the glasses on their own. And the first time he wore his glasses when we came out of the office, he was giggling at the ground and walking really slowly because he could actually see. That was a happy moment and a sad moment because I knew that he hasn't been able to see before then, but now he's seeing very well, and I can tell a big difference. He's not sitting right in front of the TV anymore, and his teacher has said how much better he's doing in class, and she notices he can see what's on the board. And I was recently laid off back in December right before Christmas and wasn't able to afford much. Without Hope Network, I don't know if I would have been able to afford his glasses. I'm just thankful for the Hope Network, and I'm very happy with him being able to see now.
Hi, I'm Bruce, and I just wanted to say thank you to the Hope Network. I just freshly came out of the dentist. I've had some work done on my bottom teeth, and after the whole process is done, they are going to give me a whole new mouth, and I just want to say thank you, because it's been probably close to a decade since I've been really able to smile confidently and feel good about it. In the line of work that I do, I'm an artist and art director, and I deal with marketing also, and right now I'm looking for employment, and it is a big issue for me to be able to smile, be able to have a good appearance. With the teeth degeneration that I had, it was very difficult. I couldn't smile, I couldn't chew. Thanks to Hope Network, I don't have to worry anymore about smiling. I think that's the biggest thing. That's what's really going to make a difference, just for me personally.
My name is Rhonda Wilt, and I'm the nurse practitioner that works here at the Mission of Hope Clinic. I feel very blessed and called to work here. I started here probably about a year ago, and the reason I came here is I had done some clinicals here when I was a student as a nurse practitioner, and I saw patients being served that really would not have had any other place to go. And it's amazing when you talk with them and teach them that they don't even know anything about their disease process. And once they realize and understand what happens to their body if they don't take care of it, then they become very involved with their care. We work really close with Hope Network. Frequently I send patients over there that come in, don't have a job, they don't have food to eat. They're spending their last penny here to see the doctor. And then sometimes we'll actually turn around and just refund their money and say, you know, this is for you today. You go and take care of what you need. And we were just thankful that the Lord provided a way for us to take care of you. Obviously, we can't do it without support from people to be able to carry this out. Our patients do pay a little bit of money to come and see us. It's a sliding scale, but it by no means meets all the costs that we have in order to keep this place, this clinic going and to serve patients. We don't just want to serve them, we want high quality care. We want to make sure that we're making a difference in the lives of our patients and that their health is getting better. But one thing that helps us a lot is how people reach out and they help us. We have doctors that come in and volunteer. We have some nurse practitioners that are starting to volunteer. People in the community that really care getting involved and volunteering. We've just had so many people that have stepped up to the plate. We still have a lot of needs. We're trying to be successful, we're trying to move forward, but it takes everybody working together and reaching out and showing that they care by helping us out with financial support. Sometimes it's other support, volunteer time, and whatever the needs are. And people just keep coming through and helping us out, and we really appreciate it. And our patients do too.
Hi, my name is Latara Smith, and I actually serve as the medical assistant here at the Mission of Hope Clinic. I've been a medical assistant for over 26 years, and I have never worked at a place with, wow, what can I say, such a compassionate group of people. I have seen patients come in here and, I mean, really distraught, depressed, crying in tears, wondering how, you know, their medical needs are going to be met, wondering if they're going to be able to get prescriptions and things for them when they leave here. And I've seen the staff here just go over and beyond, utilizing the donations and medications and equipment and things like that has been donated to the clinic, and to see them so, you know, freely give them to them without hesitation when they see a need. You know, they really work here to meet the patient's needs.
Hi, my name is Amy Lynn, and I'm a volunteer medical assistant at Hope Network Medical Clinic. First time I was introduced to the Medical Missions Clinic, it had been several years since I'd had a pap smear and had an insurance. My first pap results had come back positive for the human papillomavirus, which also causes cervical cancer in many women. My grandmother, just a year and a half prior to that, had been diagnosed with endometrial and cervical cancer and passed away herself. I went to the imaging center and was having an internal sonogram done to see what all was going to be necessary, and had come to terms with needing a hysterectomy. While the sonographer was taking my measurements and everything, she asked if I had noticed a movement on the screen, a kick, and I didn't understand what she was talking about and really didn't pay any attention. And she said when she was finished, she said, "Okay, we're all done, and by my calculations and measurements, you're 13 and a half weeks pregnant." I about fell off of her table. I'd argued with her about that I wasn't there because I was pregnant. I was there because I had cancer, and we needed to know what steps to take to get that fixed. I was pregnant. We were going to have a baby. I tried to find a physician on my own, and the first thing they told me was that I needed to consider the option of termination for the pregnancy so that I could focus on the cancer and my life and survival. I called a lady back at the clinic crying. They helped me find a physician to see me through my pregnancy. I remember always thinking about my grandmother and watching her pass away, and thinking that that's what my kids were going to have to watch. I finally had to have a hysterectomy because my cancer had come back. 2 years to that date, I had found a mass in my stomach that we'd had removed, and the results for that came back on that biopsy, and they were negative. It was the most amazing thing for me because the day that those results came back was the first day that I got to volunteer and give back to a clinic that saved my life. Hope Network is more than just a medical clinic. It's my family, and I'm grateful to have been a part of what they reach and the things that they do, the help that they provide for countless people who think that they can't get better, or if they're sick they can't go anywhere because they don't have insurance. I'm glad I had somewhere to come. I'm glad I had someone hold my hand, and I'm glad that I had someone pray with me.
Here's my shoulder, here comes